Have you ever bought something and then later regretted it? I mean, it sounded almost too good to be true, but hey, your friend said, go ahead and try it. It's great. We've got one and yeah, it works fine for us. Yeah, this is when people have what I call your private Benjamin moment. When she's on the bus and is pulling into the boot camp and says, "Oh, wait a minute, this is not the army I joined. I joined the one with the yachts and the condos and the private rooms." And yeah, well, you can have your private Benjamin moment in the Medicare game too. This is Bob Vineyard, your Medicare expert with the Georgia Medicare Minute. And what in the heck am I talking about? Well, I'll tell you. I'm talking specifically about Medicare Advantage plans. And yes, I make no secret about the fact that I really don't like them, having worked with the managed care market for well over 30 years before I switched over to Medicare. And I know that the biggest problems my clients had, and consequently the biggest problem that I had, was the managed care plans. So I just try to avoid them. I don't try, I do avoid them. And I just tell people, if you want one of these Medicare Advantage plans with the PPO, HMO, all that kind of stuff, well, you need to talk to somebody else. Now, I'll refer you to another agent, and he will take care of you. But I'm not playing that game. And if you want to know why, I'll tell you. But I just don't play that game. Okay. As I said, if you watched enough of my videos, you know that I have some rather strong feelings about Medicare Advantage plans. And my personal opinion is that they're oversold by agents, primarily because they make 2 to 3 times as much selling a Medicare Advantage plan as they do off of a supplement plan. So there might be a little bit of greed in there. And then plus, well, if you're not paying a premium, you got all this money left over. Why don't you buy some life insurance and dental insurance and insurance and all these other kinds of things? And those are all valid points as far as why I don't like them. But here's the real thing. My main peeve about healthcare in general, and especially when it comes to insurance companies, although Medicare is not an insurance company, but my main peeve is access to healthcare. And I go on and on and on and on about it because with a managed care plan, you may not always have access to health care. Usually it comes in the form of, well, you can go to this doctor, but not that doctor. You can go to that hospital, but don't you dare use any of the doctors over here when you're having your treatment over there in that hospital. Well, there's another side to restricted access to care, and it comes in the pre-authorization point. Now, my guess is whenever somebody's talking to you about a Medicare Advantage plan, they rarely, if ever, say anything about pre-authorization. And if they do, it's just kind of, well, you might have pre-authorization, but that's no big deal. Doctor knows how to take care of it, blah, 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 blah. On another video, I told you about one of my soon-to-be clients where her doctor said, you need to get off of this plan. She needed an MRI, and she had a lot of pain from cervical stenosis. And she had a lot of pain, and she needed an MRI, and the insurance carrier said, nope. And the doctor appealed, and they said, nope. And the doctor appealed again, and they said, nope. And the doctor appealed one more time, and finally said, well, okay, but you can't do the kind of surgery that you're wanting to do. So what? All right, why am I bringing this up again if I've already got it in another video? This morning, I was in the waiting room of an imaging center. My wife was having an MRI. Hopefully it's nothing serious, but it's something that came up during her Welcome to Medicare exam that she had a month or so ago. And so, like I said, hopefully it's nothing serious, but that's why you do the MRI. So while she is in there listening to all the clangs and bangs and knocks and everything else, and by the way, I was in the waiting room and I could hear, I don't know how far away the treatment room was, but I could hear it. And I said, was it really sounding like this? And, well, I guess so. But while I was in there waiting on my wife to come out, the receptionist, I just happened to overhear 3 calls in a row where he was calling people to tell them that their MRI appointment had been canceled because the doctor has not been able to get approval from their insurance company. And the conversation was the same each time. Well, Mrs. Jones, I'm sorry, but we're going to have to cancel your MRI for tomorrow because we haven't gotten approval from the insurance company. Would you like me to reschedule for some time in a week or two, or would you rather wait until this thing is resolved and you find out if you can actually have the MRI? Well, obviously I didn't hear the conversation on the other end, but these were 3 phone calls in a row, same same topic, pretty much the same words. Now, you just think about this for a moment. All this money that you're saving by not paying a premium for a Medicare Advantage plan, and yeah, you're willing to jump through the hoops, and if you can't use your favorite doctor or you can't use a doctor that somebody tells you is absolutely best in the world, well, you're willing to deal with that. But if you're in pain and you need somebody to run a test to find out, well, just how extensive is the damage and where exactly should we cut on you, if we're trying to help you out. Would you really want to wait 3 months, 4 months, 5 months, have to have constant delays just to get approval, not for the surgery, for the MRI, to complete the diagnosis? I mean, I shouldn't be flabbergasted because I hear these stories all the time. But this morning, here it was in black and white, so to speak, that the doctor's office, the receptionist was calling to say we're going to have to cancel it because your insurance company will not approve this. At least they haven't so far. I tell you, if this is the kind of stuff that you were willing to put up with, go have at it. All my clients and my wife is my wife, but she's also my client. All my clients have original Medicare and a supplement plan. There are no pre-approvals. There's no waiting period. And like they told her yesterday when they called to confirm her appointment, they said, and you don't have to pay a dime. So that's pretty good too. Okay, this is Bob Vineyard, your Medicare expert with the Georgia Medicare Minute. You take care. Have a great day.